Hi, Grace Rizza from Identity Dental Marketing here. I've been asked countless times, what's the best marketing method right now? What's going to get me the absolute best ROI? And I know we don't like this answer, but it really truly depends. In my marketing planning sessions, I start by understanding the goals of the practice. Is this a situation where we need more new patients? Is this a situation where we need fee-for-service patients? Is this a situation where we need higher profitability patients because we're at capacity with general new patients? Or do we just simply need to grow our general new patient base? And so first we start with that. And then we look at the opportunities at hand. I tend to evaluate the opportunity in SEO first because it is a much more cost-effective solution and it's a lead generation solution. So when patients are ready to buy, they typically go to Google and look to see who's available to them and then make decisions from there. So I do like to start there. But in some situations, like if one of my clients is in a market that their address is a little wonky and they're a little outside of the lines for city limits, then SEO may be a bit more challenging to achieve in their circumstances. And we'll talk about some loopholes and some strategies that can help them achieve top rankings. Despite that disadvantage, we'll set realistic expectations as to how long it should take for their individual circumstances, as well as how many Google reviews are they going to need to achieve in order to be viewed as a top result. So we'll talk through that. And if the results are going to take more than 6 to 8 months, I will likely recommend starting with Google Ads. And in this case, I'm going to go into great detail about in an individual market, what to expect in terms of cost per new patient. That helps the doctor plan how much do I really need to invest to even be in it. One of the biggest issues I see with dental marketers is they kind of overpromise and they make it seem like you're fine with a $500 investment on Google. And in most markets, you need to be investing a lot more than that to really see a tangible return. There's this deep misconception that if I test 500, then whatever I got from 500, I can just double and spend 1,000. And it doesn't really work in that perfect straight line because you have to find the sweet spot of ad spend. And of course, we're going to be working with your messaging and making sure that we're attracting people who see the ad. But at the end of the day, the major reason why, there's two reasons why Google ad campaigns don't work for dentists. The most common one I see is just not enough ad spend. And then the second most common one I see is that the marketing company really isn't optimizing that campaign. They're not leveraging a ton of negative keywords. They don't have the right focus or differentiator for the brand. Maybe there's no offer. Maybe it's difficult to get in your schedule. And they don't know how to facilitate those conversations to make it work for you. And we're really good at that. So if you're looking for some digital marketing that can finally move the needle, I think you should set up a no risk, no pressure call with me and just have me look at your market, have me look at your website, and let's see what we can do. I hope this information was helpful for you, and I hope you have a great day.